Welcome to this edition of Lightning Reports, an accredited continuing education activity. This brief expert video will spotlight the daily hot topics from the conference. Instructions for receiving continuing education credit will be provided after participating in this activity.
Hello, my name is Dan Pollyea, and I'm a professor of medicine in the Hematology division at the University of Colorado School of Medicine. Thanks so much for joining us again for episode 2 of the Lightning Reports from the 2022 ASH annual meeting. And today we're going to focus on presentations related to high-risk MDS that were particularly promising. And there were several. I think we're excited about some progress that we're making in this field. The first I'd like to highlight is abstract 855. And this was looking at this new exciting molecule. It's an inhibitor of CXCR1 and 2 called SX682. And this was given to a really tough population of patients who have HMA or hypomethylating agent failure MDS. This is a very difficult population. They have very poor outcomes. And we really have no standard of care for these patients. This is a brand new molecule that is one that we hope might have some both anti-disease activity, as well as potentially one that is able to improve blood counts, improve on cytopenias. So this was a typical phase 1 study with several dose escalation cohorts. And they found, in essence, that this was fairly well tolerated, particularly with respect to hematologic toxicity. It was fairly minimal, which is nice to see in this population because that's often a barrier. The overall results of this phase 1 study were fairly modest in terms of objective responses. There were some patients who achieved a marrow CR, other patients who achieved improvement in cytopenias. But I think enough of a signal that we would all agree that this is something that should be moved forward. And we look forward to seeing more about this molecule in the future. So ASH is always nice to sort of see some of the very, very first data come out on drugs that might have a nice future. The next abstract I wanted to discuss is number 854. And this was a look at patients who had received the oral Decitabine that comes with the Cedazuridine in combination. That's the Cedazuridine is the drug that allows you to have Decitabine be bioavailable, orally bioavailable. And so the investigators looked here at this completed clinical trial that led to the approval of oral Decitabine and looked specifically at the TP53 population. And the really notable thing about this analysis is not that these patients do well with oral Decitabine. That is really not a message that the investigators were trying to convey. It's more to look at increased granularity at differences within P53 positive patients and how they might do. So they basically analyzed separately those patients who had 2 mutations in TP53 versus 1 mutation in TP53. So we call that biallelic versus monoallelic TP53 mutations. And really what we see is that the biallelic TP53 patients do extraordinarily poorly. And they might be pulling down the entire cohort with respect to outcomes for P53 mutated MDS. So it's, P53 mutations are all bad, but there seems to be a worse bad category within P53 with these biallelic P53 mutations. So definitely something to be looking out for in the near future. Another clinical trial in MDS that is notable was from abstract 853. And this unfortunately is notable because it was not a positive study. So this was essentially a phase 2 randomized double-blind study of this TIM3 inhibitor called Sabatolimab in combination with an HMA, and they compared that to the HMA alone. So sabatolimab is a drug that the field has had a lot of enthusiasm over because of its potential ability to target leukemia stem cells, and also because it has mechanisms to sort of upregulate the adaptive immune response, which in other malignancies, other cancers, has been an encouraging strategy. So this was a phase 2 randomized study. The investigators looked at patients who were enrolled and had a primary endpoint of response rates as well as progression-free survival. So unfortunately for the field, there were really no differences, statistically significant differences in the CR rates, about 17% in the placebo arm versus 22% in the investigational arm, and maybe a trend toward an improvement in PFS, but not statistically significant for these two groups. So another negative study in MDS, and that's unfortunate. The company has already enrolled a phase 3 study with a survival endpoint that they tell us is waiting a readout. So, that is coming, and maybe we'll see some different results, but certainly a bit disappointed by this presentation for those of us that were hoping for a new drug. Finally, in the field of MDS, Magrolimab is a therapy that we're all quite excited about. And in particular for these TP53 positive poor outcome patients. And a couple of abstracts of note, 3083, there was a small number of MDS patients in which Magrolimab and Azacitidine were combined. And these investigators showed that you could decrease the TP53 clone size by the allele fraction when you administered this treatment. And so that's really encouraging that perhaps, this mechanism of action is distinct from others in being able to really specifically target P53 mutant disease, which, as we discussed earlier, is really a very rough population. And then finally, a really exciting new therapy, a new approach, abstract 4395. This was sort of an advertisement in a way for a coming clinical trial, or one that we don't have any clinical data from yet, but they reported on their design. And this will be oral Decitabine, which we discussed before, which is very convenient compared to conventional Decitabine, and interchangeable with Magrolimab for newly diagnosed high-risk MDS patients. So, lots of enthusiasm about Magrolimab. This may make combinations going forward with Magrolimab more exciting and more convenient for patients. And so we are looking forward to that readout at coming ASH meetings. So, lots of really compelling data from the MDS field to be excited about, and also, some reasons to perhaps be focusing on other therapies based on some of the negative studies that we've seen. So thank you all so much for joining me for this ASH Lightning Report on high-risk MDS, and be sure to check out our other Lightning Report from ASH 2022 on low-risk MDS, as well as check out the activity page to view the downloadable slides. Thanks so much.
We hope you found this activity useful and educational. To receive continuing education credit and to download your printable certificate, please return to the activity webpage and click on the Claim Credit button associated with today's report. Your certificate will be available to print upon successful completion of the brief post-test and evaluation.